In this video, we are going to talk about Healthcare USA versus UK. So, before starting the video, please like this video. Do subscribe and turn on the notification to our channel for future updates. Both the United States and the United Kingdom have comprehensive healthcare systems. However, the former has the largest private sector system, whereas the latter has one of the largest public sector systems. The United States spends more money than any other country on medical care, whereas England has one of the lowest healthcare budgets among industrialized nations. When compared to the United States, where healthcare costs consume 16% of the economy, England's overall expenditure on healthcare was 8.4%, thanks to significant new expenditures in the country's healthcare system. In the United States, practically all medical services are provided by clinicians working in the private sector. There are two types of owners that can be found for hospitals: for-profit corporations and charity non-profit organizations. The combination of commercial health insurance, the Medicare program, and the Medicaid program allows for approximately 84% of the population to have access to medical treatment. The remaining 16% of people in the population, most of whom are working poor and their families, are forced to rely on their own personal financial resources or on charity care in order to cover the cost of necessary medical care. While both countries' healthcare systems provide results that are among the best in the world, the United Kingdom's system produces much more consistent results across the country's population than does the American system. The United Kingdom is also scored higher than the United States when it comes to the degree of financial fairness. This finding is a direct consequence of the fact that the system in the UK is based on national taxes, but the system in the US is based on private risk-based funding. In addition, the system in the United Kingdom has very low costs in comparison to the systems used in other industrialized nations, as well as the extremely expensive system used in the United States. There is one major drawback to the system in the UK, and that is the fact that it was given relatively poor grades for its response. In the same survey conducted by the WHO, the healthcare system in the United States received the highest possible score for its responsiveness. While the system in the United States, which is not bound by financial constraints, is highly sensitive to the needs and wants of its residents, the system in the United Kingdom, which is constrained by financial constraints, is far less responsive. Waiting lists for medical care that is not absolutely necessary have caused the United Kingdom's healthcare system to receive low grades from the World Health Organization, WHO, for its responsiveness. This is the outcome of strict control over financing and resources in the healthcare system. The cost of medical care. When compared to other industrialized or OECD countries, the healthcare system in the United States is regarded as the most expensive system. Since the beginning of the 21st century, there has been a considerable increase in price. However, experts estimate that the rate of increase has decreased since 2011. Hospital care accounts for 31% of every dollar spent on healthcare services. This percentage includes expenditure on diagnostic procedures, outpatient treatment, and hospitalization costs for each visit and discharge. The remaining percentages are distributed as follows: 21% to physicians and clinical services, 10% to pharmaceutical products, 4% to dental care, 6% is utilized by nursing homes, 3% to home healthcare settings, 3% for complementary retail products, and 3% to the public health initiatives of the government. 7 pennies out of every dollar are allocated to cover administrative expenses, another 7 pennies are put into investment initiatives, and the remaining 6 pennies are spent on other professions. More than 79.5% of the entire spending, which comes to £147.1 billion, is allocated to the provision of publicly funded healthcare in the UK. There is a significant disparity in the total expenditures recorded by the several main kingdoms, with England having the largest total. Quality of healthcare. When compared to the healthcare system in the UK, the one in the United States is often regarded as being of worse quality and efficiency. This is because to high annual spending, the lack of universal healthcare, and limited accessibility in the midst of rising costs associated with healthcare. On the other hand, when compared to healthcare systems in other nations, the United Kingdom's is regarded as being above average. This is owing to the country's increased spending and the negative health indicators that are hurting the country. Public/private health services. Because of the presence of public, private, and not-for-profit organizations that work together, the healthcare system is considered a hybrid industry. This is because the federal government provides funding for healthcare facilities as well as the entire industry through a variety of special programs and arrangements. On the other hand, the healthcare system in the United Kingdom is mainly universal, meaning that individuals are entitled to healthcare and it is seen as a human right. On the other hand, there are private healthcare providers, who account for a relatively insignificant fraction of the overall healthcare industry. So, that's it for today's video. What are your thoughts on our video? Please let us know in the comments section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button and turn on the notification to our channel before you go. Thank you so much for watching.